first and foremost, we have to have like these kind of seminars so that we can educate the community at large, okay, what mental illness is about, what mental health is about. So in particular situation that you ask, so the person who's very close to that patient, they need to approach him. And again, like they need to approach in a non-confrontational, non-degrading way, and they have to kind of make them realize that how their behavior is affecting the people around them, okay? For example, if somebody is dealing with depression, and as I said, it affects everyone who is attached to that person, whether it'll be at their job, their home, their school. So we have to educate them and make them realize, okay, look, this behavior of yours have caused this effect, okay? For example, if somebody's been irritable, okay, for no reason. So you, like, not in the heat of the moment, but later on when they calm down, you can just take them aside, okay? I want to talk to you about something which is I have observed, and being the loved one, and I want the best for you. So this is I have noticed, and maybe it was something not appropriate at that time, the way you responded to the situation, and make them reflect, make them think about their behavior, and like again, like it is a very tough job just to convince anybody, okay, well, go get some help. It's so easy to say it, but so we have to come across like with that kind of situations, or if their behavior, like for example, if they are like sleeping for hours, or if they are not able to sleep, okay, we can pinpoint, okay, maybe something is not normal, your sleep patterns are not normal. Maybe we go get some help, or find out why you're having this problem. Or like they're feeling so like a lack of motivation, they don't want to do anything, they don't want to go to job, not performing well in school. So again, like say instead of suggesting, okay, maybe you have this problem, I see this problem in you, how maybe something we can do. So because I'm seeing that you're struggling with this problem, maybe let's talk to somebody in the field and professional who can guide us better. Yeah, you're welcome. All right, so let's move on to our next presentation. So that I guess Maulana has been sitting here, and I think it's very disrespectful and also hard for Maulana to see other people on the mic, and they're just sitting and listening.
For a change, it's okay.
It's okay, I was just joking. All right, so my next presentation is, it is a very important topic, which is, I think, need to be addressed a lot more than we hear about it. And the topic is about substance abuse, okay? I wish we would have more youth, but if we are getting this session recorded, inshallah, if not, then maybe somebody, even one person, I was saying to Hasan Bhai, like listening to online and get benefit, one thing out of it, inshallah, it will be worth it. And so, but if not today, inshallah, next time I'll be available anytime, inshallah. So substance abuse, it's a very crucial, it's a big problem throughout the world, and especially here in West. And our community, alhamdulillah, like we do not have as big of a problem, but we should not be naive and deny that we don't have this problem. We definitely do have this problem, and we need to address it. We need to talk openly about it so that we get more comfortable, so that in a situation when somebody, hopefully not, is struggling with this, so we can get them the help. Because again, substance abuse has been looked down upon, or the addiction problems. Okay, this person is like some character flaw or personality flaw, but it's a medical condition also. So that's what we talk about today. All right. So what is addiction? Addiction is a disease, as I said. Like it is, we should not like look down upon the people who are addicts to anything, and it can be addiction to anything. It can be substances. It can be like people have gambling addiction. Now we have the internet addiction and all sorts of addiction. We have like, unfortunately, porn addiction. So tons of addictions out there. So addiction, it is a disease that affects the brain and the behavior of that person. Okay, it is a chronic condition. It's not like just you can just get rid of it. It's a relapsing disorder, which means it keeps coming back at you, which is characterized by compulsive drug seeking, since we're talking about mostly drugs over here. So compulsive drug seeking and continued use despite harmful consequences. The person can know, like, okay, that it is harmful for them, but they will keep going back at it, okay? And long-lasting changes in the brain because of that substance use. So this is the thing that kids don't realize, especially it starts from the teenage years or preteen years, when they start using these drugs, they said maybe they start using for experimenting purposes or to be cool around their friends or the peer pressure and all those things, but they don't because of their maturity level, lack of education, lack of so young age, they don't see the long-term effects of these drugs because it can cause long-lasting changes in the brain. And again, this is what we need to educate our kids about. Inshallah, Allah keeps all the kids safe from the evil of this condition. Okay, so the definition of addiction from Addiction Medicine Society, American Society of Addiction Medicine. Addiction is a primary chronic disease of brain reward. Like it affects our reward system in the brain, and it affects our motivation, it affects memory and related circuitry, like their brain, different circuits in the brain, it affects those. Okay, dysfunction is these circuits leads to characteristic biological, psychological, social, spiritual manifestations. So it manifests in all of these areas. Biologically, there will be some problem in our brain. Psychologically, it affects our emotions. Socially, it affects our social obligations. And spiritually, it also definitely affects us. So this is reflected in an individual pathologically pursuing reward and or relief by substance use and other behaviors. Pathologically means they know that they have this, it is harmful for them, but they will keep going after it. So a person who is starting any substance for the first time, I'm sure he's not starting with an intent, it will be harmful for me or it will take me to some deep ends. It will result in my death or some other negative consequence. They just start for fun, just to have some good time, right? But again, it doesn't stop there. It goes a long way. So drug use and addiction. So brain, when we study the brain of the people who have used substances, so we can clearly see that it makes the changes inside the brain. So now we have technology that we can see how much changes as a result of different substance use. So brain imaging studies show physical changes in the areas of the brain when a drug is ingested. And what areas, and you can see how critical it is. So it affects your judgment, decision making, learning and memory, and behavioral control. So these changes alter the way the brain works and help explain the compulsion and continued use despite negative consequences. So when somebody is using drugs and it is affecting their brain and they know it's harmful for their body, but they keep using it because it changed their perception. They cannot think properly. So decision making, they become impulsive, they just use it. And the kids, their brain is still growing, and then when they use it, their productivity is down, their IQ level go down, their school performance goes down. So some more little bit the scientific information about the addiction, so that you can have a better idea. So when we use drugs, it affects our reward system in our brain, because our brain, Allah has, alhamdulillah, beautifully created our body. In brain, there is a reward system which is controlled by the neurotransmitter or chemical in brain. It's called dopamine. You must have heard of this term, dopamine. So whenever it is released, it gives us it is released as a result of some pleasurable activity, when we something that we like and we enjoy, and it is released after that. So and for example, somebody use drugs and they get a high out of the drug, so they like that feeling. So they want to use more and more, no matter how much they want to stop themselves, but they get to a point where their body will crave it. They want to use it. Their mind will tell them. They can clearly tell, okay, it is harmful for me, but because of the use, their impulsivity, decision making, their executive function is affected, so they cannot just stop themselves. They just keep going after using and using, because despite knowing that it is harmful for me. So dopamine, it is a neurotransmitter, which is a chemical in the brain that is released during a pleasurable experience. Something that, it can be anything, somebody has enjoyment with some sport, if they go and they play and they like it, so the dopamine will be released because they want to go back and play it again. But again, the sport is a good, the positive activity versus the substance use. So it is connected to the reward circuit of the brain. It acts by reinforcing behaviors that are pleasurable. As I said, that reinforces the behavior. Whenever dopamine is released, it will send a signal to the brain, yes, that I like that activity, just go back and go use it again and again. So it leads to neural changes that helps form habits. So it makes the different connection in our brain after that activity. And because of that, new connections, our habits will be formed. So anything that we are using for the first time and we like it, so their connections are being built in our brain. And that will tell us, okay, no, we need to go back and use it. And then it will become our habit. Okay? So it is released during substance use and reinforces the connection between the substance and the pleasurable experience. Which means like when we use the substance, dopamine is released, it sends a signal to the brain, oh, I like it. Then it will go back and again tell the brain, go, use it again. Okay? That trains the brain to repeat the pleasurable experience. So he will keep sending the signal. So that's why you see that when the people are addict, they cannot just stop after using it once they get addicted to the substance. They will keep using it and they keep using it no matter what length they need to go to. People end up in the legal system, with the prison system, because to fulfill their desire, they will have to steal sometimes. They have to get money and they have to do all sorts of illegal activities. And when these activities and it leads to a point, like even when you're not using these substances, it will still send a signal to the brain that I want that. It's craving, that's what they call. Although you're not using the substance, but again, thoughts of those substances will send a signal to the brain because you enjoy that feeling so much, then you will crave the drug. Then again, you'll just go back to it. So it's a very debilitating condition. So over here, they have tried to show the PET scan. It's a sort of scan that you can see the functionality in the brain. So on the left-hand side, it's a normal person's brain, who's not using drug. So I don't know if you can see these red markers, I cannot put the pointer there. Okay, so these red markers on the brain, this is showing the activity of the dopamine receptors over there. Okay, in a controlled person, you can see all these activities. But on the right-hand side, because of the drug use, what it does, it decreases the dopamine receptor in your brain. Okay. So because of the repeated use of drug, the dopamine receptors are decreasing in the brain. So what it does, so in order to get the same effect, same high, you have to use more and more drugs because dopamine receptors are getting low and you're not getting the same high, so you have to go back and use it again so that you can get a high and higher again. So that's what it causes to your brain. And that's why it's so hard for people to stop the drugs. But the good news is, like if you stop using drugs, you can recover your brain after a while. The longer you stay away from the drugs, so there is some hope that brain can recover. So in this slide, and the first slide is the healthy person. You can see the more red dots in the middle where the yellow thing is. Again, it is showing some activity of the dopamine. And the next slide, it shows a person who was using methamphetamine. It is a type of drug. After 1 month of abstinence. So you see there's not much activity there. There's no red thing over there. And on the last scan, the red things are again showing up. It is 14 months of staying away from drug. So after 14 months, you can see it can come back to the they can reinstate their brain activity. But again, when you use these drugs, I've seen in my clinical practice, so sometimes the damage can be permanent. People can get so much damage in their brain, they end up getting some serious mental illnesses like schizophrenia. People can get schizophrenic just because of the drug use, because their brain connections are so messed up that they cannot go back to the baseline. So it's not always, I'm not giving the hope that you should use drug and be abstinent and then you will be okay, perfectly fine. No. The damage that you cause to your brain, you can never go back to the same level. Okay, so these are some drug classifications. I will quickly go through these things and so that we can talk more about what I want to talk. So these are stimulants. These are the medications, as Dr. Siddha was mentioning, like the Adderall, Ritalin. We use it for ADHD. So they have some short-term, long-term effects. Then central nervous system depressants, like the benzodiazepines, like we use Xanax and Klonopin. These are anti-anxiety medicine. People abuse all of these things, like the stimulants, anything that they can get hold of. You would be surprised, the things that you cannot think of, like person can abuse, they will abuse that also. I had a patient, and people were so concerned that when he was using the bathroom, his stool was green color. Like everybody, they have done. I said, nobody was able to figure out what's going on with him. So they found out that he was just drinking mouthwash because it has some alcohol content. So when you're an addict, you just go to any extreme. And this, like, we have an emergency. This kid came. He was high on like cough medicine because what they do, like they drink bottles of cough medicine to get high. So it's just crazy. Then hallucinogens. There are some certain drugs like LSD, PCP. There are all sorts of drugs that they kind of make you hallucinate. You have intensified feelings or sensory experiences. You just like take a trip. You just like don't know of different sensory experiences. You're just feeling the colors, like just very scary situation. And then alcohol, cocaine, heroin. So I don't want to go into details what they do, but in the interest of time. Then methamphetamine, which is a stimulant-like chemical, but it's not like the medicine. It's a street drug, and it comes in the pill form, powdered form. People can snort it, they inject it. Then the crystallized form, it's called ice crystal. And people use like the heroin and combined heroin and methamphetamine. It's called speedballing. So, and again, like when they use IV drugs, it can lead to HIV and hepatitis, all those things. Then marijuana, like I will be talking a lot more about it because it's such a common thing. And opiates, which is our heroin and other drugs in that class. Okay, so substance use disorder. So what is substance use disorder? Substance use disorder, they are clinically sick. We talked about addiction, which is an illness. So substance use disorders, they are clinically significant impairment or distress with like following 10 or 11 situations or conditions that you will see, or symptoms, which you will see in a 12-month period. So then we can diagnose that person, he's having a substance use disorder. Somebody who has used once or twice would not be classified as somebody who is having a substance use disorder. So in order to have a substance use disorder, which is considered as a mental illness, you have to have 10 or 11 of the following symptoms over the period of 12 months. Okay, so what they are, like a substance is often taken in larger amounts or over a longer period than was intended. So you keep taking more and more substances, or you, for example, you thought, okay, I'll just use it for a week. You end up using for 6 months, okay? So there is a persistent desire or unsuccessful effort to cut down or control use of substance. So you keep want to use that drug, or you're not able to cut down your desire, or even if you try so hard at it, you are unsuccessful in cutting down. A great deal of time is spent in activities necessary to obtain the substance, use the substance, or recover from its effects. So people will go, that's all they will just think all the time. Okay, how I can get the drug, how I can high next time. And then either they will spend their time like getting the drug or using the drug, or then getting off the effect of the drug when they're going through the withdrawals. So they're like great deal of time is spent after drugs. Then when they are not using drugs, so they're craving drug or a strong desire or urge to use the substances. Then recurrent use of substance results in a failure to fulfill major role obligation at work, school, or home. Since I work right now in inpatient setting where we have detox unit, we treat patients with substance abuse problem. So you will see most of them are homeless. They have broken families. Their relationships are affected. Most of them have legal problems. They have on probation, or they have served prison time because they're either selling it or possessing it or doing illegal activities. It leads to, unfortunately, prostitution and all sorts of criminal activities, theft, burglary, everything, you can just name it. So it affects their social obligations at work, school, at home. They can, like while they're intoxicated, they will be hitting their family members, their spouses, the kids. So use of substance continues despite having persistent or recurrent social or interpersonal problems. So even despite having these problems, they will not stop the use. They will just keep using it. So this is one of the symptoms that they have this disorder. Important social, occupational, or recreational activities are given up or reduced because of use of substances. So they will not be able to keep up their obligations in life. They will not be able to provide for the family. They will not be able to be part of the community because they are not able to be there. Use of the substance is recurrent in situations in which it is physically hazardous. So they're driving while they're intoxicated. So it's danger for themselves, for other people, but they will be doing these things because their executive functioning or their thought process is just impaired. And use of the substance is continued despite knowledge of having a persistent or recurrent physical or psychological problem. Lots of people like who use this substance, they have HIV just because of the drug use, not because of their like lifestyle, because of the substance use, and they will still use it. They have hepatitis B, hepatitis C, which is very common with the needle use, but they will still use it. Then they develop tolerance, which means they need a lot more amount to get the same effect or same intoxication. They will keep using more and more and more and more. And markedly diminished effect with continued use of the same amount. If they're using the same amount, but they will not the same high. So this is called tolerance. And then they have withdrawal symptoms, as we said, like they want to, like when they stop using the drug, their body will go through the withdrawals. And different substances have different symptoms of withdrawals. So today I just want to talk more about marijuana because it's such a prevalent thing. And like there's so much lobbying going on to make it legalized, and it is legalized in many states, and which is a very scary picture because medical research does not support it. It's just all the politicians that they're doing out there, but there's no good use of there's no use of this drug in mental health, at least. Maybe in pain, they will say in cancer or some appetite stimulant, that's about it. But again, as much they like publicize it because on the social media and everything, people don't even consider it as a drug anymore. They say it's an herb. But if you talk to the kids, they will say, oh, it's a natural thing. Like, yes, not every natural thing is out there for us to consume. Okay, so impact of cannabis on mental health. CBD is different because the brain has different receptors for where it's called Endocannabinoid System, like in our brain. It has different components. One is one affects the THC, which is the main thing in marijuana. Other one is like the Cannabinoid System, which affect more regulate our sleep sometimes, the pain and all those things. But again, like if there's it's hard to when you go that route. Like, why go that route? There are other treatment options are already available for whatever you're trying to use CBD for. But like and again, it's so confusing for the kids especially, and even for the adults to how to differentiate because CBD is so like common in these days. Like people use lots of stores are opening. A while ago there was testosterone everywhere. Like everybody was getting the testosterone shot. It's just like I think there's a wave of things going. People, they try to keep the public engaged in something, but I guess there's not much CBD. I don't know. Do you have any experience with the CBD?
Some cancer patients use it for pain or for appetite stimulant, but it's not really something which you can abuse.
Yeah.
It's not a drug to abuse.
It's better than cocaine and heroin.
Okay, so potential risk of self-medication with marijuana. So it's called self-medication. It has a psychological dependence, long-term memory loss. People can increase the use, and high level of psychiatric disorders can happen because of the marijuana. Okay, so we were talking about? Yes. Yeah. 5 minutes? Okay. Yes, so we can, I guess, quickly finish the marijuana, I guess. Yeah. So as I was saying, the endocannabinoid system, it regulates appetite, sleep, mood regulation, circulation, pain management, and immune function. This is the natural system that we have. Okay, and there are different enzymes that kind of regulate this system. It's called anandamide and 2-AG. But the THC also work on this system, on these receptors, okay? And what it does, it produces like the high, kids will say, we are getting high because of and it binds to these receptors for a long time. Naturally, that the hormone that body produces, it gets away from this receptor in a short amount of time, but THC binds to it for a long time and stays in the system for a long time too, like for several days. So the cannabinoid receptors, they're found in brain and in other parts of the body, outside the brain as well. Okay, so the physiological response, when we use cannabis, so what happens to our body? When either we smoke it, we use it as a vape, or we eat it. So it quickly passes from the lung into the bloodstream, and it carries to the different organs of our body, including the brain. Okay, and it affects begin almost immediately as soon as you smoke it, or the effect is immediate and lasts for at least 1 to 3 hours. It affects your decision making, capacity. It affects your concentration. It affects your memory, and it can be affected for like days after the use, especially in the regular users. It's not just like you use it in 3 hours you'll be done from the effect of. So it affects your decision making. So kids can make poor choices while they are using this drug. So it's so normal. It's not making us like any different feeling like the hardcore drugs, but it affects your decision making capacity, concentration, and if they are going to school and colleges, concentration, memories. So you will see the problem in their grades. But if marijuana is consumed through the food, so it will take 30 minutes to an hour to feel that same effect. Okay, so most of the cannabinoid receptors are found in the brain where THC work, and it affects your pleasure, memory, thinking, concentration, sensory and time perception. You will see that things are moving so slow, and they affect your coordinated movement. So cannabis activates the endocannabinoid system, which again gives you a feeling of high, because it releases dopamine, as we discussed earlier. So these are all the different parts of the brain that are affected with when you use marijuana. Okay, so there are different parts. It makes you more paranoid, panic. It slowed the reaction time, so your movement is kind of affected, and your coordination is affected. So your memory is affected, appetite is affected, your thinking, judgment, and you have that good feeling, a euphoric feeling, and also affect your pain sensitivity. So the higher dose effects of THC, we just mentioned all of these things, the thinking, decision-making, problem solving, it can make you paranoid. Lots of kids think that it's such a mild drug, but it can actually make you paranoid. It can make you psychotic. You can hallucinate after using marijuana. And one important thing that I tell my patients, like when they're using marijuana from the street, their friend is giving it to them, or they're buying from somebody, the person who's selling this thing, he is not your well-wisher. He's out there to make money out of it. God knows what garbage or trash he's putting in this drug. You think, oh, I've got the purest strain of the marijuana and all of these things. But he's making money out there. He's give you the garbage thing. And lots of times, patient will come psychotic to the emergency, and they will say, we have just used marijuana. But you will check their drug screen, marijuana will not be there, because they were thinking it was marijuana, but that person who has ever sold it to them, it was something else completely. So it can cause psychosis, delusion, panic. And so for the kids, like when they're growing, like their brain continues to develop until their mid-20s. Okay, when there's somebody start using in preteen or teenage, so the brain get affected. Okay, and the brain is making new connections whenever you're learning new things, and they're like all the things that you have learned, so they kind of reinforce that. It's called myelination. And also it's called when you do the pruning of the trees, like just to make them like healthier grow. So that process also goes on in the brain. So when something is not of use, they just cut it. So marijuana affects those things. It will not like let them cut the bad part of the circuits which are not in use. So it affects the synaptic pruning, it's called. The brain eliminates little used neurons during adolescence, but when you are using marijuana, this process is blocked. And there's a myelin sheath, which is the covering on the neurons, which we are using for our good functionality. So it stops that process also, myelination. So it is again talking about the same things. It affects the memory, emotion, anxiety, motivation, appetite, stress, muscle coordination. So in the brain, like there are different areas of the brain. So marijuana affects, or THC affects, the gray matter of the brain in your frontal cortex, which is used for most like the decision making, impulse control, and learning. So when these things are affected when you're young individual, when your brain is still growing and you have to do so many good things by the use of this frontal cortex, and like marijuana affects it, so you are not able to think and do your things. Okay. Then it affects your mood, cognition, So these are some processes like loss of control of emotion, worse problem solving, slower processing, lower verbal comprehension, poor memory. And risk of prolonged use, over 90% of adults with a severe substance use disorder begin using under the age of 18. Okay, so this is the outcome of marijuana use. Like 78% of the 2.4 million people who began using in the last year were between the age of 12 to 20. And how it affects, this is a child brain, it grows, and you cannot see the brain over there. It grows over the period of like from the child, teen to the adult, and it decreases your IQ to 8 points, like drops the IQ if you continue to use this. And it results in lower IQ, loss of, like the dropout from the school, you cannot graduate from the colleges, which results in lower satisfaction with life and loss of jobs and low, I guess I'm rushing here because Maulana has been sitting here. Again, this I think slide is important, like how to spot the addiction, like if somebody you can see and how you can tell that person's probably going through some problems. So you will see the changes in their personality and behavior. Lack of motivation, irritability, agitation, then change in their appearance. Their eyes will be kind of bloodshot and frequent nosebleed because some kids often use the snorting of these drugs. Their weight loss or weight gain. And odd mannerism, like they've been shaking, tremors, or speeches they're slurred. And lack of personal hygiene. They will not be taking showers, not taking care of the personal hygiene. Unusual need for money. They'll be either stealing things or asking for money. And changes in their habits, friends, and activities. So we have to be very vigilant around teenagers. So I guess substance use disorders, there are 23 million American ages 12 plus need treatment for substance abuse, but only 10% receive treatment. Versus 85% of the 29 million people in the US with diabetes receive treatment. So 85% of the people who are diabetic receiving treatment versus 10% of the people only with the substance abuse they're getting treatment. All right, thank you.
Thank you very much, Mustafa. I don't know about you all, but my dopamine levels are high because I have been addicted to the Al Murtaza chai. So if you are depressed in the audience, go and get some chai for a break. We are not breaking that way, just go and get it, okay? But for achieving optimal health, you have to have a balance between your physical, mental, and your spiritual health. Some just talk about it, some do the walk with the talk. And Maulana Shamshad Haider doesn't need any introduction. Today he is mainly here as a counselor, because that is one major component of treating mental health, and that is the role of counselors. But he also has to have another amama because Maulana Yasin Akhi had to run to Dallas. So he is also going to be talking a little bit about the spiritual aspects of mental health and illness and how you connect to have that inner peace despite the turmoil that you face. His clinic is the Wellness Restoration Clinic, wellnessrc.com, and he can be reached at his office at 832-995-1524. So with a loud salawat, let's welcome Maulana Shamshad Haider. Salawat.
Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. Maulana Yasir had to leave, so I'll just speak a few words to cover that base as well. Please recite the salawat. Religion and faith prevents mental health issues. There is no doubt about that. And the more you have trust in, God, and the more you are associated with the community, and the more you practice on a personal level, values, hope for redemption, forgiveness, all of these, they help give hope. And we Shia Muslims, alhamdulillah, because of our commitment and loyalty to Ahlul Bayt alayhimus salam, their hadith, their ziyarat and du'as, we have a very strong base of our community, people who are more connected with their community. They belong to a very positive peer group, especially our youth who form friendships within our community. These are lasting friendships, unlike the school friends who you change every year because people change schools. They're, friends that you can keep for life are from our community, If you grow up in an Islamic center, for example, or attending Islamic programs, conferences, whatever, ziyarat tours, this and that, all of these form your connection to our community. Now, as it relates to the work of counseling that I do, and I will define counseling, what it is first. If I can have your attention, I'm sure a lot of people are listening online. All the doctors, psychiatrists, Dr. Sadaf was right? Yes. Yeah, she joined online as well, and Dr. Mustafa, Dr. Hasan. Great job organizing this for raising awareness on this very critical issue. Just as Dr. Sadaf pointed out, 50% is the medication, medical treatments, and 50% is therapy, which is involved in our recovery. So recovery is the key word, recovery. And I use that word a lot because, so there are two models for looking at health issues. And I don't want to divide up treatments, but just two ways of looking at it. One is the medical model, which is focused on sickness and its illness and its treatment. That's one way to, so you focus on what's wrong and try to solve that problem through medication, surgeries, procedures, different things, fix the problem, medical problem. You identify the problem, scan it, examine it, look at it, what it is, evaluate, assess, whatever, and then treat it. So solve the problem or manage the problem, that's what the medical model helps. If I'm explaining it correctly, I'm not a doctor myself. But the other way of looking at it is the wellness-based model, which is not about focusing on illness, because the person is not the illness, the person is not the sickness. Like a person who has depression, this person is not a depressed person. He's a person who is experiencing depression. like you say, cancer patient. Actually, he's a person who is experiencing symptoms of cancer, or he has some cancer diagnosis. So wellness-based model means that we are trying to get this person to recover so he can pursue his life goals. We don't live our lives to treat cancer. We don't live our life to treat migraines. Our life goal is not to treat, for example, ulcers. Life goal is not to fix some medical issue. You see, this is not your life. If I ask somebody, what's your goal? He's not going to say, okay, my life goal is to manage my migraines, for example. That's not your life goal. But the life goal is the goal that you had even before you got sick. You wanted to become someone. You were following some dream, pursuing some dream and vision in your life. But this disease came up as a barrier towards which is preventing you to move towards your life goals, you see? So how do you get past this barrier? Either you manage this barrier, you get around it, remove the barrier, cross it, jump over it. What do you do with this barrier? So a wellness model means that you are finally able to focus toward your future. Because the illness can get you stagnated into your past or the problem. But your focus should be shifted through therapy towards your future. That will give you motivation, hope, strength, right, to live even with these problems, whatever the problem is, medical problem, mental health problem, whatever that may be. Just to wake you up, please cite a salawat. So my work as a counselor is 7 days a week, and I see individuals, couples, families, online, offline, for many years now, 11 years at least. I would focus on this issue of trauma, just a few minutes, because the trauma is two types. We have something called shock trauma. For example, assault, sexual abuse, crash, accident, right? Something of that sort. And then we have strain trauma, which is neglect, abandonment, isolation, right? Loss of opportunities, consistently losing opportunities, or failing, or not being able to socialize because of early life neglect issues and other things. So these things happen in early childhood, and they impact the development of the brain. Because brain is all about relationships. The wiring of the brain stem is all about how you relate to people. One simple example, when the child is born, right, the child starts crying, right? You've seen babies crying when they're born. So this child is having a lot of distress and what we call dysregulation. So what does the mother or caregiver do? Comfort, right? Pick up the child, comfort, like rock the baby a little bit. What does that do? That helps the baby feel safe, and this external, factor helps the baby regulate himself. Because this person is helping regulate this baby, so his baby is able to calm himself through external help. Somebody who's providing that help, this baby is able to calm down. Through this consistent, attention given to the baby, this emotional connection, that is what we call emotional attunement, the exchange of gestures. You see the cues that the baby is giving and the mother is reading them. 65% of the mothers do a good job in this. A lot of time mothers are not able to, because of domestic violence going on, because of drug use. Mothers are involved in alcohol, other things, they have own mental problems, they're not able to. So a big percent of children grow up with neglect. So what happens when the baby is not able to connect? So this newborn is comforted, feels safe, a pattern is established in the brain. Okay, I feel distressed, then I feel safe. Because people take care of me, I am okay, right? So then again I feel distressed for some reason, and again someone comforts me, I am okay. This pattern establishes in the brain. Gradually the child learns to take care of himself, that I deserve it. People take care of me, I get okay, I feel better, so it means I'm okay, I'm fine, I should take care of myself. Gradually, child learns self-care. So he doesn't ignore his needs. People often grow up ignoring their own needs. They can't even read their own body. They're feeling cold, they don't realize. They're hungry, they don't eat. They have problems with hygiene, they don't take showers. Right? They need medical help. They never saw a doctor for 5 years. They need emotional support, but they ignore it. They're in a relationship where they're not getting anything. They don't realize it. They even cannot provide emotional support to another person because they never got it. So these are some of the factors. So strain trauma, neglect and abandonment causes lifetime issues in relationships. Abuse and shock trauma causes problems in intimacy, problems in relationships, getting along with people. A lot of relationships are in trouble because of trauma. So we often, mental health professionals, they're treating a problem, I won't say often, but a lot of times ignoring the presence of trauma everywhere in this patient's life, overlooking it because there's no time. They ignore the signs of trauma. Current trauma, past trauma, right? So therapy is about helping. So therapists are also advocates. We have a shortage of therapists. A lot of people don't go into this profession because they don't know. It's a very exciting and successful, lucrative profession that people can go into and enjoy. Enjoy helping people. And really be independent, provide awareness to community, serve community as well as live their own life comfortably. Why is this so much focus on just a few occupations, few professions? There are 12,000 registered occupations in the United States. 12,000 in the handbook of Department of Labor is more than 12,000 professions in the United States. But you ask people, what do you want to do? You'll count only a few. In one hand's finger, you can count it. Doctor, lawyer, whatever, few things, right? IT, engineer, some engineering, one or two fields of engineering. That's about mostly it. People can't go any further. We need advocates in the community. People who can rally, who can get people to, address the issues. A community that does not have enough people providing awareness, right, will have problems like suicide, mental health issues, relationship problems, families breaking up, relationships ending in a lot of problems, divorce to abuse to whatever, one person going to jail or both, children being taken away from parents, and just this distancing between the family members where people can't get along. What does that do to individuals? You see, when people can't get along, families cannot remain intact. What does that do to each person who experiences this? Grief and loss can cause depression. Grief, often untreated, because the person who experiences grief cannot express himself very well. Others don't know how to connect with him. Here's another problem. And how many of us have experienced grief in our lives? Every one of us has experienced it, right? How many of us have experienced some kind of trauma in our lives? All of us. But if you look at it carefully, you will see that, man, I was one of them. Right? So the encouragement for you to approach a mental health professional, right? Whether it is for medication or whether it is for support and therapy, right? It's equally important, because the idea is to recover so you can pursue your life goals. 93% of communication is non-verbal. I have patients every day. This patient sitting in front of me is saying, I don't experience depression. I don't experience guilt. I don't experience this. I don't experience that. And this person's whole body is telling me the opposite of that. Flat face, flat voice, body sitting like this, lack of eye contact. All of this is speaking loud and clear. This person is experiencing major depression. Doesn't know it. Person who is isolating himself, the social anxiety and other things, what is that about? Trace it back to childhood experiences, the neglect. Parents too busy, right? Or having their problems, in relationship. Child blames himself, isolates himself, doesn't know how to connect outside. If there's trouble at home, the child cannot socialize very well, cannot bring any friends, of course. He doesn't want to get his friends into this mess. Cannot connect outside either, doesn't feel good about himself, can't make friends. Can't socialize means is a major problem with self-esteem. Cannot do well in school because he's very timid or has a poor self-esteem, lacks confidence in himself, doesn't even trust his own ability to do well, socially, academically, professionally, whatever. Later on, these things pile up. Help should be sought early on. And obviously, a lot of people come to me just for referral to a psychiatrist. And I provide referral, obviously. But I try to let them know that it's voluntary. Nobody is drugging you. Nobody's trying to medicate you. Don't think this is the option. Because you have to see if you can get better without. Can you learn the social skills? Can you help your own brain wire itself again? Like rewire the brain so you feel better, so you don't have to put all those chemicals in your brain? If you can correct the chemical balance in the brain through better socialization, improving, being more structured and organized, right? Feeling supported, feeling safe, and therapy is about feeling safe. So you gradually stand up on your feet again. So you start looking towards the future. Generally, people who come with mental health problems, they are stuck in the past. Stuck in some relationship issues, stuck in abuse, negative images, memories in their brain. So they can't come out of that. The idea is to get them, and we see that happening all the time. Recovery happens all the time. It's just relative, but everybody can see improvement. Inshallah, help us all. A very good event. We pray that we can do more of this on a larger scale, with more involvement of community. Bisara salawat.
Maulana is pretty high, no? He is tall. He's high on addiction too, of learning and teaching.
He didn't bring anything to get us high. He talked about it.
So really appreciate Al Murtaza organization for arranging this important seminar. It requires leadership and understanding that this is a real issue. There are some general questions, and I appreciate people participating online on Slido.com. That system did work, so we appreciate that. So let's start with some general questions for both of you, and I think there's a mic that you can share. First question is, how does one remove stigma against mental health illness from the community? Either one, Maulana can handle it, or Mustafa.
I think programs like this, educating the community, is the best way of removing the stigma. The more openly we talk about these topics, the more comfortable we'll get it. And inshallah, raising the awareness and educating the community is the best way.
Maybe Maulana can address this kind of similar question, but how do we stop community to stop maligning or making light of mental health, where there's not even a recognition, but maybe somebody not able to get recognition in the community, or they make comments that they keep people away. I think that's what they're trying to get at.
I mean, we should be a community of educated people who read books, who have a habit of reading. Like in America, the history of mental health goes back 115 or so years. That's how we have reached this point now. The first book was written in 1911 or something. It became a bestseller, a mind that found itself. It was a guy who was put in chains for 3 years for major depression, and suddenly he, for some reason, he recovered and came out and wrote a book. Told his story that I was actually inside. I knew myself, but my mind was blocking everything. So people used to think they are ghosts in his mind, the magic or spell or something. They think these people are what, cursed? There's some kind of 100 years ago. So then they start looking at it as a health issue, purely a health issue. And brain needs to be connected with the body, right? If you have a disconnect between the brain and the body, you run into problems. So a lot of times, because of trauma, the brain disconnects from the body. You can't even feel that you are in pain. So we awareness, because if we are an educated community who are exposed to knowledge, reads, then we have solutions. But if we are people, we just go by hearsay and we think, we know everything. There's no solution of that. There's no magic can solve this problem. America is an educated society. They teach these things everywhere. In school, psychology has been there in schools everywhere. People take courses. People are aware of this. There's literature everywhere. All the media, everything is talking. And with this country, who is so traumatized society, American society is highly traumatized. They've been in wars after wars. There are veterans everywhere. People in mental hospitals packed with people staring at walls. Drug addicts everywhere. Parents who have been in jail for all their lives. A lot of people I talk to, they've never seen their dad. A lot of people haven't seen their mom or dad. A lot of people don't even know their mom and dad. They don't even know. They grew up in foster homes all their lives. So this society, with that level of problems, they're able to manage mental health issues to some extent. Through medical help and through social workers and counselors and priests and whatever else, media, education, all of that. To some extent, it's not exploding at least in your face, right? You can see there's something being done because of awareness, because of education, because of the people going into these fields. Every church has counselors. If not inside the church, there are a list of providers people are being referred to, counselors, all the time. There's no shyness about it because they're aware, they're educated, they're aware, they know this is a health issue. They have to get help. Otherwise they'll break up their marriage. They have had for 30 years. They'll be in ruins, they'll lose their kids, they will be in jail. Nobody wants that. Still people go into that, but anyway.
Mustafa, can you? Yes.
On the same note, definitely they have come a long way in treating mental health conditions and recognizing it, because there was a stigma over here as well. Like back in the days, people used to be sent to asylum for years. Now they get away with that, and now they have the state hospitals. So, but still, despite having all this education, still the mental health system is not where it needs to be in the society at large. And definitely, as Maulana said, there are tons and tons and tons of problems, because for any plant to grow into a fruitful tree, you need all the right ingredients for it to make a fruitful tree, like the sunlight, the right soil, good amount quality of seeds, and all those things. But the society is such broken over here. As Maulana said, there's no parents around. When the kids are growing up, there are lots of abuse and trauma when they're growing up. Nobody knows their father, even if they're there or not. So alhamdulillah, we don't have this level of problem in our society. So that's why we don't have that many problems in mental health. But doesn't mean that we should not get educated and get help whenever it's needed, because we do have traumas in our society too. But we need to acknowledge it. We need to educate ourselves about the traumas, and we need to talk openly about it amongst our family, so that somebody knows, okay, when they're dealing with it, that's what it is, instead of just kind of, because the blessings can become a problem too if we do not, because we have such a good support network. Sometimes we suppresses the mental health problems because everybody's cover up for other person, or just kind of look at the other way and just kind of deal with that person. Oh, this person has been labeled as, he's about gusse ke tez hain, just deal with him that's the way it is, right? Or ye to matlab bahut shy hain karke or maybe the person is dealing with anxiety and depression, but we label them and we just cover up for them and we provide for them.
Yep.
So they just go undiagnosed and untreated and then become a problem for the person.
From a practical point, there is a question what not to say to people suffering from depression or other mental illness. So when you meet somebody, sometimes after a long time they have come in to the center.
Yeah.
But what comments, what are some positive ways to deal or communicate what not to say and what can you say?
If we are a supportive community, we value people, we will be more understanding. We are quick to respond, quick to give advice. We should train ourselves not to quickly give advice, give your own opinion on things, like understand the person's situation. Like if person is, for example, shy, you try to understand what he's experiencing. Like it's probably just hard for him to connect with people. Why? Because he's feeling scared, like people will reject him or he's not good enough or something. So some sign of that, you can encourage the person, like I know someone, you could talk to if you like, or provide something to read. Provide an article or something, pass it on, people read. But the last thing you would say is like, hey, you have a mental problem. Because the word mental is a very strong word.
Yeah,
I was glad to see the word mental health seminar when it was announced. Because people just to remove the stigma is good to use the word.
Right.
So people get used to it because it's like medical health, mental health. Mental health, medical health. So physical health, like that. So you should be familiar with this. Instead of be scared of it, we should know that if I'm feeling depressed, I can feel it, right? It's very easy to tell. Now sometimes there are some mental issues which the person doesn't feel it, but others know it.
And that's a good
Yeah.
question that somebody is asking. If a person doesn't admit he needs to see the doctor, how can we convince that person? What do we do when someone makes himself a victim all the time? And kind of similar to that, there is this question of if one is deep in depression, how can they get out of that hole? When to commit a patient if that person is an adult? Like I think the second part, maybe Mustafa can deal with the legal issues of committing. But the first part of maybe you can address, how do you convince, as you said, sometimes the patient doesn't know.
Let's say the husband has anger issues, right? The wife is not always fighting, right, with him, or he's not always in an argument. So when they're calm, she can sit down and say, I love you, and I don't want to lose you, and you don't want to lose me. And there's a part of us that connects well. But there's another part of us that gets triggered. So we want to, reconnect, really be closer again. What can we do to do that? You tell me any ideas? Obviously the idea is to get some person to help them connect better, understand each other emotionally, and also when these people are arguing, something is happening inside them. They don't realize. Like either they are getting anxious or getting too angry. But a part of that is just fearful. I don't want to lose this person. The angry, anxious, fearful, and another part of them wants the person to stay in the relationship. I don't want to lose him. See? They're not aware. And somebody can help them reconnect by working together, understand each other better. So person you trust is the best person who can give you good advice, Anyway, you want to answer?
Most of the part of committing.
So, for the commitment piece, like in mental health, we have this aspect that we can commit the patient to the treatment against their will. It's called involuntary treatment or commitment. So it is only applicable when the person is a danger to themselves or others, or they're so sick or like they're having active hallucination that they cannot live independently on their own or with the help of the other people. So if they are in that state of mind, yes, you can fill out the application with the magistrate and they can sign the paperwork and the deputies can come and they take him to the hospital.
Question from the floor, if somebody has.
I think you were asking about like what not to say to the people like
Yes.
earlier
Yeah.
that Mala already mentioned like answered. So in general, as a whole, like being a follower of Ahl Bayt, we have to be respectful to the other individual at house or outside in the community. And sometimes we are in a habit of some people have like making fun of other people, just like
The
kids is so
pagal,
common. Yeah. Besides the pagal, like again, like if somebody is like have some different what do you call temperament, so they get picked out easily, like in the group of friends, a circle, and so we have to like be very careful. Like again, like sometimes we can say things jokingly, it can be hurtful to the other person. And we do not know where he's coming from. As Maulan said, like what has happened in his past or what he's dealing inside. So we said it in a lighter note, but that person might not take it in that way. Okay, so we have to be very careful about other people's feelings and what they feel. We might have a moment of laugh, but that person probably traumatized for days because of that one comment, and it will stick to their mind. So we have to be very careful whenever we say things, especially hurtful things to the other people.
There are some questions related to your topic that you gave. The first one, why is suicide more common in the young? Is it hormones, self-esteem, spiritual disconnect, addiction? You can maybe tie both together.
For the adults, like we went through in one of our presentations, that the brain continues to grow. And the teenage years itself, it's a kind of challenging phase. In itself, it's a syndrome. Like when people going through the normal teenage years, because so much change is going on in the brain, the hormonal changes in the body, physical changes, and the mental changes. So there is definitely like the physical change, hormonal change in the body, and their stress of the society, like the peer pressure, and the bullying is such a big cause these days, and the substance abuse. So they're like multifactorial, like there's so many issues, and they have this energy, and they have these resources and means to commit the suicide, like the access to the drugs and the guns and all those things. So that's why it is a very high rate in this age group.
Okay. I don't know how much of this question is related to mental health or not, but since it came, I'm going to give it. How to deal with stress and injustices, situations around you when people are completely silent. I don't know whether that person meant it mental health or injustice around the world. I don't know, but
How to deal with stress when the what?
how to deal with stress and injustices, situations around you when people are completely silent. It could be a Saas Bahu issue. I mean, I don't know. I mean, I can take it to different levels
Yeah,
here.
I was thinking more on a global scale.
But
like
it
there's
could be a
injustice.
global scale too.
Yeah.
I mean, coming from, the brother who is very politically active, I think it is a global thing. So, I mean, maybe you can connect with the PTSD in war veterans and how it's affecting, the world.
I guess
mean, there are so
injustice-
many levels you can take this.
Being the follower
But you
of
can
Imam
start
Sahib,
with the
we have to
Saas
say
Bahu
something.
first.
We have to say things about the injustices, and we cannot. And there are different levels of like raising your voice against injustice, and in an
But
appropriate.
even within a family, there are injustices.
Yes,
As a
definitely.
counselor, I'm sure, Maulana get dressed, and then politically too.
I mean, a person's perception has to be understood. For example, if an African American comes to me talking about depression, I have to be culturally very aware and I should be very, what's the right word? Careful, cautious.
Not to trigger.
And also understand that what are the systemic problems, discrimination, racism that has brought him here. Because he's born with a kind of a disadvantage, which is physically he has no problem, but socially he is disadvantaged because of the society, prevalent racism in the society, right? So I have to be an advocate for him also. I have to be also very empathic to understand and also value him as a person, and he should be able to feel safe. So I should not re-traumatize him, Because let's say, I mean, for just sake of discussion, my color of skin could trigger him. He see me as, I'm not a black guy, so he might see me as a, trigger. His body could be triggered. Not consciously, subconsciously it got triggered. A lot of things to be considered. Anyway.
Yeah, I think just last 2-3 questions, but I don't want, because a lot of people did do it. I don't know what this means. Maybe it was from your depression talk. What is stress point therapy? Did you say anything? Stress point therapy? I don't know what they meant. Therapy. Stress point therapy. So I don't know whether they meant. So there is no such thing as that.
There's too many approaches to therapy. We keep coming up.
Is this possible that depression is genetic? Any genetic predisposition?
Yeah, very, very high genetic predisposition for not only depression, but every mental illness. Substance abuse has such a high genetic predisposition, and definitely, yes. And especially people who have family history of depression or any other mental illness, they should be even more they're aware and educated about the mental health issues if there's a family history, so that they can on the outlook for if there's any early signs of depression, so they can get help instead of delaying it until it gets.
Like you, Dr. Mustafa mentioned earlier, that two people are, affected differently by the same trauma, because one is more vulnerable than the other. So where's this vulnerability coming from? It's biological. One is more biologically vulnerable, or maybe because of early life experiences made him more vulnerable, because of neglect, bullying, discrimination, whatever be the case, or just changing schools too many times, whatever, losing friends, getting more and more isolated, and this COVID thing, all.
Yeah, and lastly, do hormones play any role in depression? Is that why? How much of increased depression in women is related to hormones, and how much is environment?
Yes, no. Hormones definitely has lots of role to play in depression. Like I can just name few hormones, like the thyroid hormone has a role in depression, and then like vitamin D has a role in depression. And like when you go through, you see when the women, they are pregnant, they're going through hormonal changes. So the level of the fluctuation in the estrogen, progesterone affect their moods. That's why they're like so much, like sometimes they have like mood irritability, and sometimes around like the menstrual cycle, the people have mood changes because it affects the hormones.
Oh, yeah, maybe he can handle it too. The Slido is still, the questions keep coming. So somebody is really listening. How do you deal with someone who threatens themselves when there is an issue? How would you approach the situation, especially when they refuse to make amends? Connected with the previous question, how would you approach them when they refuse to listen? What mental health? What mental issue would this be? Yeah.
Well,
when they refuse to.
Like,
so I think it ties to the previous question. So I don't know.
I don't know. Like threaten to harm themselves.
Right.
If somebody is like threatening to harm themselves, like
they need to be committed,
or
at least take professional help.
Yes, definitely get a professional help, but not committed. Committed again goes to you have to have that kind
Legal.
of proof, yes, to show it to the judge. Okay, the patient is really danger to himself. It's not like, oh, I want to die or I want to kill myself. You have to have some concrete proof to commit the person. But if somebody is voicing these thoughts, so definitely it's a time to seek some mental help. You should not take it lightly, or he's just saying it out of anger or something like that. Because we have patients coming into the hospital because they just made a statement, and like once they are in the hospital, they realize, oh, I better not say it next time, because they are around psychotic patients and patients with different mental health problems. So it should not be taken lightly for both the aspects, because like we're gonna say, okay, he's just saying it because out of the frustration, and God knows like what's going on in his mind if he really mean it. So we don't want to take this chance.
So ending up with the real brain behind this, Dr. Hasan Jafri, thank you very much.
Absolutely.
And I see Brother Muhammad Hussain, our Board of Trustee here, coming in.
Assalamu alaikum. I just need to take a moment to thank Dr. Hasan Jafri, Dr. Mustafa, Dr. Khambar Jafri, Maulana Shamshad Haider, and especially Dr. Sadaf Javed, who she was not able to come, but she participated enthusiastically from home, and I think we got a very good session. And with all the questions that we had from the floor as well as online, it shows that the community is interested, that the community wants answers. And I think we should take this opportunity to provide that to the community, and we'll work on it for other sessions and other health factors, from general health to cancer to etc., so that we can make our community more aware, so that they can come for assistance and help whenever they need to. Thank you very much. Appreciate for participation. We have lunch for everybody, please, and dua with.
Thank you. Just want to say last few words again to Murtaza Management Board of Directors for helping us arrange this. I think it's very important. I think that just the takeaway points are that we need to just know about ourselves. You know your soul, then you would understand what is going on with others. So then you can relate to them. The more self-awareness we have, the more we can connect with others and understand what is happening with them. And then the two other points that as parents and adults, very important to understand that there are small souls, minds growing in our household, and we have to be very careful around them, because what we do can have an impact not only on them but generations to come. So we have to be very careful about our actions, and the words are both can be harmful and therapeutic. So a lot of psychological therapy is just talking to people. So when we speak with others, with our family members and community members, it can be equally therapeutic and it can be equally harmful. So we have to be very careful about what we say. So let's finish this with dua for Imam Zamana. And Allahumma salli ala Muhammad wa ali Muhammad. Allahumma kulli waliyyika al-hujjat ibn al-Hasan salawatu alayhi wa ala abai fi hadhihi sa'at kulli sa'at waliyyan wa hafizan wa qa'ida wa nasiran wa dalilan wa aina hatta tuskina wa arzaqata wa tumattiya fiha tabiya. Allahumma salli ala Muhammad wa ali Muhammad wa ajil farajahum. Thank you.
Ali,